Hi, I'm Megan. I'm going to be your student physical therapist today.
Hi, Megan.
How are you doing?
I'm doing okay.
Okay.
Yeah.
I hear you're here for a little bit of diabetes management.
Yes.
All right,
Yeah,
awesome.
I'd like to learn some more about that.
Learn some more?
Mm-hmm.
Well, I will teach you. That's what I'm here for.
Great.
I just wanted to talk to you first about your blood glucose level.
Okay.
And are you aware what blood glucose means?
Not really.
It's the amount of sugar in your blood.
Okay.
In people with diabetes, that sugar, the insulin doesn't work as well as it should, so the sugar remains in your blood.
Okay.
Okay? So you need to take your blood glucose with that finger thing they gave you.
The prick thing?
The prick thing, yes,
Okay.
exactly. And a normal blood glucose is about 110, so you want to stay around that area whenever you can. If your blood glucose gets too high, a great thing you can do is exercise.
Okay.
That will bring your blood glucose level down.
Really?
Yes, isn't that crazy?
That is pretty cool.
It's pretty cool. Our bodies are crazy. And however, if your blood glucose is over 240,
Yeah.
and you have ketones present in your urine, which you can test with that little strip.
Okay, that'll tell me?
Yes,
Okay,
then do not
cool.
exercise.
Okay.
It will not be good for you then.
Okay.
Okay?
Yep.
Like I said, exercising is very, very important to maintain your glucose levels.
Mm-hmm.
However, you're going to need to replenish your glycogen stores after you exercise, which
Okay.
means that you need to eat, take your blood sugar,
Okay.
and
Yep.
depending on what it is, it will probably be a little bit lower, so you need to eat some carbohydrate-rich food.
Okay.
Okay? And I want you to be taking your glucose before and after exercise
Okay.
as well. And if you can, keep that in a log format. And
Just write down every time.
just write down every time, and then you'll kind of know how much food you need to have in your system before you exercise and how much you need to take afterward.
Okay.
And I wanted to talk to you about some signs and symptoms of hypoglycemia, which is low blood sugar.
Okay.
And if your blood sugar gets too low,
Mm-hmm.
you'll know that you'll probably get shaky, maybe dizzy, sweat, become hungry, headache, pale skin, maybe notice some behavior changes, or clumsy, or if it gets really low, you could go into seizures. Okay? Yeah, so we definitely want to take care of that. And if you do have hypoglycemia or low blood sugar,
Mm-hmm.
I want you to consume some sort of sugar right away.
So like juice or something?
Yep, like juice. They have glucose tablets that you can
Okay.
keep with you at all times. You just let it dissolve on your tongue.
Oh, that's good.
But if you do have juice or like a piece of hard candy or crackers, that will help bring your blood glucose up.
Okay.
And you're going to want to wait about 15 to 20 minutes after doing that and take your levels again to see if you got it up to a high enough level. High blood glucose, like I said, you can exercise if you have that.
Mm-hmm.
But signs and symptoms of it being too high
Mm-hmm.
would be frequent urination or increased thirst. So if you
Okay.
notice those things, I would take your blood sugar level right away.
Okay.
Because if that is left untreated, that can develop into ketoacidosis, which is life-threatening. And signs and symptoms of that are shortness of breath, or if your breath smells fruity, or if you're nausea or vomiting. If so, you want to call your healthcare provider right away.
Okay.
And what I want to go through is the importance of inspecting your skin every day. A lot of people with diabetes will develop lack of sensation in their feet,
Okay.
and that can happen without them even knowing that, and then that's when you develop diabetic foot ulcer, which I know you've heard about.
Yeah. Yeah. My doctor told me about those.
Yeah, and that happens a lot if you don't, if you have something in your shoe and you don't notice it because you can't feel it,
Mm-hmm.
and then all of a sudden it gets worse and worse, and then you get an ulcer and it's hard to heal.
Okay.
So I want you to be looking at your feet every day,
Mm-hmm.
including the bottom of your feet and in between your toes.
Okay.
And I know not everyone can bring their foot up at here, so you
Yeah.
can look at it.
Not the most flexible person.
Right, so what you can do is hold a mirror, hold your foot out here,
Uh-huh.
and hold a mirror out in front of you.
Oh.
And you can see there and in between your
Okay.
toes.
Okay.
And preferably a larger mirror that's standing up, so you don't have to hold it, would
Right.
be nice. And you can just put your foot up right to that mirror.
Okay.
And also helpful is a magnifying glass, you know, because these pressure ulcers can start as just a tiny little sore or a little red spot. So if you have a magnifying glass, you can really get a good look at your feet and get treatment right away if any of those things happen. So, or you can always have a family member inspect your feet if you have someone you're comfortable with at home.
Can check my feet?
You can check your feet, you know, just go through everything that I'm telling you and tell them how to do it.
Okay.
And that will be helpful. I want you to look for any blisters or sores, corns or calluses, or red spots, swelling or drainage from a sore that you already have, and broken toenails and cracked skin.
Okay.
Okay?
Mm-hmm.
And in order to prevent all of this stuff from happening, I need you to take care of your skin. So that includes washing your feet gently every day, and you want to dry your feet really well, making sure to dry clean in between your toes and dry in between your toes. And if you get dry skin on your feet, make sure to use lotion so it prevents any cracking or anything like that. And cut your toenails straight across. I know a lot of girls like to keep them nice and shaped and anything like that, but that can cause an ingrown toenail.
Okay.
And could potentially cause an infection or a sore or anything like that. So, you know, it's one of those little things. So definitely cut them straight across. Try not to walk barefoot. And
even around the house?
You know, if you keep your house nice and clean, it's okay. The reason I don't want you to walk barefoot is if you have decreased sensation in your foot, and you were to, you know, walk down your driveway and step on a rock and cut your foot and you don't realize it because of the lack of sensation, that can get bigger and bigger. So, I mean, you can, around your house is okay. Wear clean white socks if you can. That will let you know if there's any drainage or blood. You know, if you have black socks on, you're not going to see it. So everything will show up. And lastly, I want you to check your shoes. I want you to make sure that there's nothing inside them before you put them on. Like I told you, just have a little rock in there, a little pebble, that could make a sore worse and worse and worse. So always take a look there. Make sure that they're the adequate size and width for your feet. If they're too tight, it can cause some rubbing and cause a sore, or if they're too loose and your foot slides in them, it could cause a sore. And the best way to do this is to shop for shoes in the afternoon, because when you wake up in the morning, your feet are actually the smallest they're going to be all day. As the day goes on, they're going to get bigger, just because of the natural fluid of your body. They just kind of swell up a little bit. It's normal. So if you shop for shoes in the afternoon when your feet are the biggest, that will allow your shoes to fit all day long rather than just in the morning. And any new shoes you buy, please break them in gradually. You know, we don't want a blister to develop that gets worse and worse and worse, so breaking them in gradually will help. And if you see any signs or symptoms of a wound, I want you to call your healthcare provider immediately and get that taken care of. And again, continue to check your feet every day, exercise, watch your blood glucose levels, and doing all those things, you'll be able to manage your diabetes just fine.
Great.
All right, any questions?
Not really.
All right. Wonderful. Well, have a great rest of your day.
Thank you. You too.
Thank you.